Greetings. Thank you so much for joining us today. I am joined by three of my most favorite colleagues on campus. Again, my name is Kim Sterrett. I'm Director of Parent and Family Programs. And today we're going to talk a little bit about wellness on campus this fall, about how UA will continue to support your students' wellness, and how that might look a little bit differently this year than it has maybe in the past, or for incoming families, just giving you a heads up of what your student can expect. And so we're going to get started with Margaret Garner from the Student Health Center and Pharmacy. Margaret, would you tell us a little bit about kind of your area's services and how those might be adjusted or increased, honestly, as we enter this fall?
Thank you, Kim. I'd be delighted to. And let me add my welcome to each of you. We're excited about your student returning. And I am Margaret Garner, the Executive Director of the Student Health Center and Pharmacy. So let me just right out of the gate say that all of the services that have been available from the Student Health Center and Pharmacy have continued since we suspended operations back in March, but after spring break. So none of that has changed to remove any services, and they continue now, and of course will into the fall. So just like your student has had access to your primary care physician at home, all those primary care health services are still in effect and have not reduced. So primary care, women's health, allergy and immunizations, pharmacy on site, and psychiatry, as well as medical nutrition therapy, counseling, and services. So all of that is the same for those of you that are already familiar with that. How have we changed, and how are we continuing those changes as we enter the fall? So social distancing and masks are required for anyone entering the building. So in an abundance of caution and care and attention to prevention, we had instituted drive-through services. So with the use of Zoom meetings like this, your student that has been around in the summer or did not go home after spring break and continuing in the fall will be able to schedule a Zoom virtual visit with one of our primary care providers. And if that is enough, and they need a prescription will be provided. They could call into the pharmacy and drive up and receive that prescription from one of our pharmacy techs or staff. So we have had an extensive drive-through option, both for a virtual visit phone to phone, or drive up and pick up your refills or prescriptions. That will remain. In addition, we have had psychiatry that went totally virtual. So we'll see a little bit of a hybrid of that, some on-site and some virtual. Again, this has been to continue all of our services to our students, no matter where they are, here in Tuscaloosa or back in your home areas. So now, what does that look like in terms of other services? To make it certain that you understand that our prevention education services have again continued through social media, through some virtual meetings as well. We have, in addition to our medical and pharmacy services, and a very impressive attention to health education and prevention and wellness education. So that is led by 4 professional health educators. The activities that we would normally be having with groups of 10 to 200 and more will be modified so that we can continue to practice the guidelines of the Centers for Disease Control and the Alabama Department of Public Health. So a number of those will be virtual, and some of those will be broken up into different components of reasonable size for the area or location where we can accommodate your students. So that is going to be a continuation of what we've been doing, and we expect to continue that in the fall. We
Margaret,
will
can I
also
ask you,
continue.
can I ask a quick question? I don't mean to
Yes,
interrupt. When you talk about the telemedicine, can you just reassure folks that those connections are secure, that that's not something that might be Zoom bombed? We heard about that a lot, but that's a different kind of teleconnection than what potentially we are using right now.
absolutely. And that was a critical component that was worked through the university OIT and those systems in place at not only UA, but UAB, a major medical center, as well as Huntsville. So those are absolutely secure. Privacy and confidentiality of all health-related services of the Student Health Center are first and foremost expected and delivered. So our curbside, where we might have a provider walk up to the car, there's only one person in the car, so that is also confidential. And then our ability to communicate with your student through our patient portal is absolutely secure, meets all of the UAOIT privacy and security standards. So thank you, Kim, for asking that excellent question. We would certainly want everyone to know that that is a priority, and it is delivered with that commitment.
Thank you.
Any other questions, Kim?
I did. Oh, I know that it's a common question from families. How are they potentially, if they need to get access to their students' records or anything like that, medical records? And what I explain often, and you can correct me if I'm wrong, because I want to hear them to hear it directly from you, but anytime a student visits a physician, they essentially determine and let the physician know exactly who they want to be able to, the physician to discuss any medical information with. And that's upon each visit with each specific physician or specialist. Would you recommend that that be the way that they go still, for the student to write down a parent or family member if that's something that they want to whom they want their medical information released?
Yes, that is totally in the hands of the student, who we can share information with, as well as what kind of information can be shared.
Mm-hmm.
So they sign this, and it is included in their permanent medical record. So if you called and wanted to talk to a provider, they would be looking in the medical record, one, to see if they can share, to see if it has been updated for sure, and what kind of information can be shared. And I think it's important for parents to know that this is a federal law. Mm-hmm. It is an expectation of all healthcare facilities. So it's hospitals, it's physicians' offices that have medical records, it's private offices, it's all the way around. Yeah. When you are billing insurance and providing those kinds of services. So that is assured, and that is in your student's hand. Your student can change that declaration anytime they wish.
Okay, great.
Yeah, that's a very good question, because I think parents are frequently concerned and oftentimes say, well, I don't understand. I'm paying for their university education, and why do I not have access? And it's because it's federally mandated.
Right. Yeah, and you have to abide by HIPAA. I think that a lot of times college parents and family members hear about FERPA, but because it's health related, you actually
have actually
both.
Because we are part of a Institute of Higher Education, we are FERPA, and our records are considered health education materials. So we are under
you don't
FERPA.
have to abide by both?
Well, that's a very good question. So
sorry, we're getting way off track here, but
yeah. We do if we're talking to a hospital that we know that they are HIPAA. So then we jump into that. But literally for your students and dealing with us, we are under FERPA, but it still is a mandated privacy confidentiality that is only released by that student.
Brilliant. Well, I've learned something new. Thank you so much. Anything else? I kind of interrupted you mid-thought. So anything else you wanted to relay about fall operations for your area?
The only thing is, so students may need to be seen inside the building who are well. So if your student comes in for regular allergy injections, we will screen them at the door. They wear a mask. If they're well and coming in for an allergy injection, they sit in a different part that's separated for allergy and immunizations. If a student is coming and they are sick, then they're screened. We know where to place them. We know how to manage that. We have a separate sick area now that's separated for well visits versus sick. If someone really needs to be seen rather than stay in the car for that Zoom, then we get them into a secure room that doesn't exchange air in the clinic. So that it is a heightened level of concern. I think the thing that I've told parents who've called me, there's not a safer place in Tuscaloosa to go for your student for healthcare needs, because we're only seeing college students, so we don't have folks with a string of chronic diseases, elderly, and that we don't have babies and children and that kind of thing. And so we've got the seating designated. You can sit here, but don't sit here for social distancing. And that's been true since the week following spring break and will continue into the fall. As we go through this COVID period together, just know that this is a secure, safe, and the sanitation is going on consistently every day, during the day and night.
Fantastic. Thank you, Margaret. I suspect that we will chat again when we are approaching flu season to talk about the differences between cold, flu, COVID, allergies, all of those types of things. So
absolutely, because
we will catch back up.
The symptoms look a lot alike. That's why these Zoom meetings have really taken an anxious student down 5 levels. This looks like this.
Yeah, absolutely. Thank you so much, Margaret. I appreciate it. I appreciate it. Next, we have Greg Vanderwaal, who is here from the Counseling Center. Greg, can you catch us up on what's going on in your area?
Absolutely. Thank you, Kim. My name is Greg Vanderwaal. I am the Executive Director of the Counseling Center. And just like Margaret said, we have been working really hard this summer to be prepared to offer your students and our whole campus community the same quality services we've been able to offer before, just with a little bit of modification where we need to. The biggest change that we've made is most of our services are being done virtually. The good thing about the services we provide is they can be done virtually, safely, securely, in a confidential way, and they can be really effective. So all of our services, for the most part, will be happening that way. We'll still be able to offer individual counseling for students, group counseling and workshops, outreach education to the campus community, consultation services, not only to our students, but you, our parents, and our faculty and staff. If you ever have questions about a student, your student or another student where you may be concerned about their well-being, we are here to talk and to consult with, and that won't change. And we're even able to offer our crisis intervention and urgent consultation services for students through virtual means, but we are also prepared to meet with students in person if we need to, and are taking appropriate social distancing and other precautions to ensure that we do that safely and effectively. I'm also excited, we're expanding some of our services, especially in the realm of education for the campus. We typically run a few workshop series each semester. We have a Mind Matters workshop series and a suicide prevention education workshop series. We're excited, we're going to be offering more sessions of those this fall. We're going to be adding some topics to our Mind Matters series. There's lots of great topics like how to adjust to stress and cope well with this situation that we're all in, how to deal with anxiety, how to build healthy relationships, how to build resiliency. All of those kind of topics we'll be addressing this fall. And I think a lot of our students will have an easier way of accessing that because it's going to be done through Zoom interviews. They can do that from the comfort of their own home. We're excited about that. We've started some additional support groups for students, a general support group for students who are struggling with stress related to all of these changes in COVID and how life looks different right now. We're also offering a support group for our Black and African American identified students who may be struggling with a lot of the social injustice that we've been facing as a society, and we'll continue those into the fall. We developed a new workshop series in partnership with the DEI office on campus that's about resilience and empowerment through racially challenging times. And right now we're in the middle of our first go around of that, but we're going to be offering that again in September as well. And we're really excited about that. So we're able to bring more support, more education related to mental health and well-being to the campus, and we're really excited about that. But really the biggest change is that we're doing most of it virtually. And just like Margaret talked about, we're working really hard to make sure that it's quality services we're bringing to your students in a confidential and safe manner. We are a center that's committed to your students' well-being.
That's great. We always make sure that we include the Mind Matters dates in our newsletter every month. And so we'll make sure that we are aware of the additional workshop opportunities that you all will offer. Any tip that you might offer families as their student is kind of transitioning in this unique kind of situation, whether they're an incoming first-time student or even a returning student, when they're returning to something that is looks so radically different than what they have experienced in the past? Kind of any tip that might be helpful for them as they approach this?
Absolutely. You know, normally at this time of year, we're talking a lot about adjustment and change. Transitioning to college is an exciting time. It's a lot of new things, a lot of great changes, but change can be stressful. And when we're dealing with that stress, there's some really good things to pay attention to that can help us adjust well. And that's building good routines, staying connected to your support systems, getting connected on campus and with people in your new community, which may look different this fall, but there are so many opportunities. I've heard about so many of them to continue to get connected, and I think there's going to be some great ways for students to do that. And then pay attention to taking care of yourself. You know, eat well, get some exercise, go to sleep when you're sleepy. You know, those simple things that we take for granted sometimes, and often they're the first thing that kind of gets left behind when we're dealing with stress, but they really need to be at the forefront of our priority when we're dealing with adjusting to change. And the thing I'm saying with adding all of this stress related to COVID and these adjusted university functions, that we really just have to pay attention to those things more. And it's really good to take things one day at a time and to focus on what you can control. Focus on taking care of yourself, focus on what you can do today to bring you closer to your goals, to engage in what you need to do to be a successful student here. And if you can do that and piece together one day at a time, you're going to do really well.
Fantastic. Thank you. I think maybe I need to take some of your tips to heart myself. So I'm going to stick those away in the back of my brain, FYI, and maybe make some changes along the way.
Every time I talk about them, I remind myself too, because
Yes.
I'm in the same boat.
That's right. That's right. Well, thank you. Before we turn to Andre from the University Recreation, I do want to mention that the Women and Gender Resource Center also offers some counseling services. And so you can contact their office to learn more about their program services, how they might be adjusted a little bit, as well as collegiate recovery and intervention services. They do some group gatherings and in support of students who are maintaining their sobriety on campus. And so, or managing any type of recovering from any type of addiction. So please we encourage you, your students, to seek out those support services that are still full steam ahead, ready to support your student in whatever way they can, even if they might be adjusted slightly. So, Andre?
Kim,
Oh,
could I
yes.
actually mention one more thing?
Oh, yes, of course.
We have tons of resources for students on our website. There's some free self-help modules, there's free screening tools. There's a lot of really good information that if you just check out our counseling.ua.edu website, there's a lot of good stuff there too.
Fantastic. Thank you. That's a great resource. I appreciate it. Last but certainly not least, Andre Love, here with us from University Recreation. Can you tell us a little bit about what we have to look forward to as students try to maintain their physical health and along with it, their mental health in your facilities and through your programs and services this fall?
Absolutely. Thank you, Kim. Thank you for pulling this together for us and giving us a platform to be able to talk about what we are going to offer this fall. As Kim said, my name is Andre Love. I currently serve as the Executive Director for University Recreation. And I can tell you we have worked very diligently over the last few months to be able to offer all of our services and programs along with our programming for this upcoming academic year. And so with that being said, we kind of think that our services that we offer are actually divided into three facets. That being the facilities that we offer. Most people know about the rec center. It's one of the stops, the student recreation center, which is one of the stops during the tour for the university. But we also have our programming, which for us is it centers around our intramural sports, sport clubs, aquatics, and things along those nature. And then our services. And so what's included with the services are, we include our fitness services with that. And so that includes like our group exercise classes, our Pilates reformer classes, personal training, things along those lines included in those services. And so we have gone through the facility, and I'll start with the facility aspect of it. We're looking forward to having people back in the facility this fall, beginning in August. And we will have some modified hours. There's been some updates and changes as to access. We've been able to capture some space in the facility by removing some pieces of equipment and such to allow us to be able to appropriately physical and social distance within the facility. And so as of now, all of our cardio pieces and our strength training pieces in those respective areas are at least 6 feet apart. In many cases, they are more than 6 feet apart. That's from seat to seat, so the active space for those pieces of equipment, or if you're standing on a treadmill, the space between the treadmills where the participant would be is actually probably a little bit more than 6 feet apart. So we were able to do that and capture that. We also have in place all of our staff will be wearing PPE, personal protective equipment, to help also keep your students safe. And so we're very thankful that we've been able to have some time to go in and deep clean the facility, which is what we've done. Again, there will be some limited hours, but we will be available because oftentimes we realize that the rec center and our programming and services may be the only, maybe one of the few things that a lot of people are looking forward during the day where they choose to come to visit us. And how great is that? Nobody wrote a prescription. Nobody's making them come. They choose to come see us, and so they do it on their own accord. And so we always seem to have happy people that come in to visit us, and we look forward to that. Along the side of programming, we talk about intramural sports in particular. We are going to still have intramural sports in the fall. That will be not what we traditionally have. It will look a little different. In most cases, we're going to find some opportunity to offer individual and dual sports such as tennis and maybe racquetball, where we can socially distance and physically distance while participating in those sports. Right now, we're preparing also to possibly offer an outdoor soccer league on a full-size soccer field. We can safely do that. There are some guidelines and such that are coming from various sources various national sources that we kind of subscribe to that will help us be able to do that safely and have some recommendations in terms of sanitizing the ball and other things. And so we're looking to be able to offer sports such as that as well. And then for us also in terms of programming, we will have some esports. So some electronic gaming and online sports options that we will have. And so we will look to offer those as well. We've had some of those going on right now. We've continued those as we, over the summer, we've had the opportunity to offer some of those esports. So we've learned from that. And so we'll definitely know how to offer those and which platforms work best for us and how to manage that once the fall gets around. And last but not least is our services. And part of our services are our group exercise classes, which are very popular. We will offer those, but in a limited capacity with smaller numbers in each of those classes, so we can safely distance people while in those classes. But for those that still may not be comfortable with coming into those classes, we'll have a virtual option for most of the classes as well. And over the summer, we actually created a UREC YouTube channel that has all of our classes, most of our classes that we've offered throughout the summer will be also streamed here, and you have an opportunity to go in and view those at your leisure. We also have some classes that we will stream live. And so some great opportunities there to stay physically fit and stay physically active. Our personal training services, we will still offer those. Those are very popular for us. And so what we're offering is individual personal training. We will not do group personal training. We will do individual. We'll do partner training for individuals that are from the same household. And so that's an option as well. And so we're just excited. We're excited about the opportunity to be able to provide these services and still be able to stay in touch and in contact with a lot of our students and even our faculty and staff that take advantage and utilize those services in our programs and our facilities. So we're excited about the fall.
That's great. That's great. We actually publicized this summer on our social media channels several of your virtual group exercise classes, and so we hope to continue to do that. Anything that's open to the public, we will continue to publicize that with parents and family members, and they can go ahead and if they want to tune in at the same time as their student, they can all do the same group exercise class together and get fit. Right? Now's the time.
Absolutely.
Awesome. Thank you so much. Does anybody else have any tips or anything else that you might offer to viewing families who are, I'm sure, excited to start this next chapter with their student?
I have one, Kim.
Yeah.
And it was prompted by a comment that you made, and that is, if a student is getting ill, don't wait. Call in and give us the opportunity to evaluate. It may be early on and things are simple. It may be early on and we have one piece of advice, and tell your student to please call back if things get worse, because as you know, whether it's starts out sounding like a cold but then becomes flu, those things are progressive. And so stay in touch, and your student can communicate back with the provider through that patient portal and will be answered promptly. So don't wait out there and second guess. That's not good for you, and it's not good for those around you either. So pay attention and give us a call or give us a question through the patient portal.
Yeah, I think that's a great tip and can be applied to so many things, right? If you're concerned about your student and their well-being on campus, you're concerned about your student is concerned about their academics or about getting connected, really reaching out to somebody. It doesn't matter who you start with, that person is going to be able to get you to the right place. We are a campus of professionals who are ready and waiting to assist students and family members, but we don't know what we don't know. And so if we don't know that your student is struggling, then we aren't able to help them. So please either encourage them to reach out or you reach out on their behalf, and we can connect with them to make sure that they're getting the resources and assistance and support that they might need. Any other last minute thoughts?
I was going to share something in a very similar vein to that. And the piece I'd like to add is we always emphasize with our students that knowing when you need help and knowing how to reach out and ask for it is not a sign of weakness. It's a sign of resilience. Nobody can handle all these things, and all the wonderful things you encounter in colleges and the challenges you encounter there as well. Nobody can handle those on their own all the time. And so recognizing when you do need help and reaching out early is such a sign of resilience and growth that we really encourage that in our students.
Absolutely. Absolutely. Thank you. Andre?
Yes, I just wanted to add, we always get the question of how do I access the rec center?
Yeah.
and who has access to the rec center. So as part of this, as you can see behind me here, these lovely turnstiles, they're actually all touchless. And so bring your action card and or your mobile device, and you'll be able to scan to get into the rec center, to any of our facilities. So that also leads to who has access to the rec center and our programs and services. So anyone that takes at least 5 credit hours on campus during the fall and spring has access to all of our facilities, programs, and services. And so bring your ad card, and we look forward to seeing you.
Does that include online classes that they might have?
Yes, and so all of our virtual options will essentially be available to anyone that can log into those channels. Right now, it's not password protected, or there's not any credentials that they have to submit to be able to have access to our virtual channels. So
I was talking more so, some students are only taking online courses through their specific college, and I didn't want them to think that just because their method of instruction is online, that doesn't mean that means that they don't have access. They still would have access to your services.
So in this time of change, if the class is scheduled to be an on-campus class versus the online option, so those students that are virtual learning from the online perspective only, and that class was never designed to be an on-campus class, they will not have access to the rec center unless they purchase a membership.
And generally those would be the courses through continuing study, the College of Continuing Studies, or Bama by Distance.
Absolutely.
If they are in any other class that is being delivered online, but is not through Bama by Distance or through College of Continuing Studies, then they would have access.
They still have access. That's right.
Brilliant. Terrific. That's a good distinction. Thank you so much.
And thanks for coming. I went down a different path with that answer for that question.
That's all right. I followed both. I can roll with it. So I appreciate it. Thank you all so much for your time, for your details. I know that right now, parents and family members greatly appreciate all the thought that you all are putting into your plans for this fall and how you plan to support their students. And so, I thank you on their behalf. Thank you so much. We look forward to all of you tuning back in to view some of our other webinars in the series, and we hope you have a great day, and roll tide. Roll tide, y'all.
Thanks, Kim.
Thank you.